Hi, let's talk about the glossopharyngeal and vagus nerves as they pertain to the larynx and the pharynx. In this video, we'll talk about the glossopharyngeal cranial nerve number 9 and the vagus cranial nerve number 10's major targets and functions in the neck. So let's start where their stories begin, at least as far as we're concerned. So the glossopharyngeal and vagus nerves are going to exit the brainstem, and then they're going to exit through the skull, through the jugular foramen. The jugular foramen is named that because that is the origin for the internal jugular vein, and this space is going to conduct cranial nerves 9, 10, and 11, the accessory nerve, out of the skull and inferior to the basicranial region. Now let's take a look over here at an inferior view of the basicranium. So there's foramen magnum. Here are the occipital condyles, so we can orient ourselves. Here is an out of focus projecting mandible. And so just lateral to the occipital condyles, we can see these jugular fossae, and the jugular foramina are just lateral within these fossae. You'd have to cant the skull slightly laterally to get a full view of the length through these foramina, but I assure you they're there. And just anterior to these foramina are the entrances to the carotid canals. The carotid canals are where the internal carotid arteries enter into the skull. And if we look at the adjacency of these spaces, and even the adjacency of these spaces here, we can see that between these two openings, we have the thoroughfares for all of the structures being conducted within the carotid sheath. So 9, 10, 11, IJV, as well as internal carotid and all the way down common carotid, all are carotid sheath contents. And so because they're coming through the basic cranium, where the carotid sheath is originating. So let's start with 9 here. Glossopharyngeal pharynx gives us some clues as to what 9 is going to do. In this particular session, we're more limited to what's going on in the neck, so we're not going to focus as much on the glosso part of the glossopharyngeal nerve or other functions of it, and I assure you it is a spectacular, important cranial nerve. But in this session, it's important to understand that the major contributions for the glossopharyngeal nerve is that it is the major afferent for the pharyngeal plexus. The pharyngeal plexus does not afferently serve the nasopharynx. The nasopharynx is the portion of the pharynx which is contiguous with the nasal cavity. This particular portion of the pharynx is served by a division of the trigeminal nerve called the maxillary division of the trigeminal nerve, or V2, and the specific branch is aptly named the pharyngeal nerve of V2. On the illustration here, we can see the glossopharyngeal nerve descending down through the jugular foramen and then coming down, riding this muscle here. This is important. That muscle is stylopharyngeus. It's one of 3 longitudinal pharyngeal muscles. And what's important to understand about this classical anatomical relationship between 9 and the stylopharyngeus nerve is that 9 is one of the major exceptions to the efferent innervation of the pharynx, which is generally vagus, but in this case, 9 efferently innervates the stylopharyngeus muscle, which is very convenient based on its overall location. Also, 9 afferently serves the carotid sinus and body. So those are going to be features that are down around the common carotid, the bifurcation of the internal and external carotid for measuring blood pressure through baroreceptors in the wall of the carotid sinus, as well as chemoreceptors in the wall of the carotid body. Cranial nerve 10, or the vagus nerve, is the major efferent to the pharyngeal plexus. As I said earlier, the one exception to this is that the stylopharyngeus muscle is innervated by 9, so vagus doesn't have a part of that. So 10 is sending pharyngeal branches to the plexus to efferently serve it. Beyond those branches, the vagus nerve sends off a superior laryngeal nerve. That superior laryngeal nerve we can see here, descending down and then branching into an internal branch and an external branch. That external branch, if we follow it down, is heading toward the cricothyroid muscle, which is one of the intrinsic muscles of the larynx. That cricothyroid muscle is an important elevator of pitch. So the external branch of the superior laryngeal nerve does that. The external branch of the superior laryngeal nerve also, although it's not shown in this particular illustration, is going to send some branches down to this muscle. So this is the cricopharyngeal part of the inferior pharyngeal constrictor muscle. So let's take a look. I'll outline all of the inferior pharyngeal constrictor muscle here. So there is a thyropharyngeal part that attaches to the thyroid cartilage of the larynx, and then there is a cricopharyngeal part which attaches to the cricoid cartilage of the larynx. And this cricopharyngeal part, as we'll see, receives several sources of innervation. And so one of them is from this external branch of the superior laryngeal nerve. The other branch of the superior laryngeal nerve, the internal branch, is heading down here, and it is going through this little hiatus in the thyrohyoid membrane here. And it's being accompanied by the superior laryngeal artery on its way through. This internal branch has two functions. It is afferent from the mucosa of the larynx, proximal to the vocal folds, and it is also secretomotor to the glands within the mucosa, proximal to the vocal folds. So that's doing quite a bit for us. One of the ways that I use to differentiate the internal from the external branch is that I remember that I am sensitive on the inside and muscular on the outside. Now, let's talk about another important branch here of the vagus, the recurrent laryngeal nerve. So the recurrent laryngeal nerve is another vagus branch. In this particular illustration, we can see the full range of things that the vagus nerve does for us in the neck and elsewhere. But the one thing that I really wanted to draw your attention to, and we'll start here on the right. So this large purple thing is the right vagus, and it comes down, and at the root of the neck, it sends the right recurrent laryngeal around the subclavian artery, and then that nerve heads for the tracheoesophageal groove up towards the larynx. On the left side, we see a great asymmetry here. So this left vagus nerve is coming down, coming down, coming down. And at the level of the arch of the aorta, it sends the left recurrent laryngeal nerve around the concavity of the arch of the aorta, where that quickly heads medially to the tracheoesophageal groove, and that ascends up to the larynx. So as we can see here, there is quite an asymmetry between the size of the left recurrent laryngeal nerve and the size of the right recurrent laryngeal nerve, with the left being significantly longer than that of the right. Well, these recurrent laryngeal nerves are very important innervators for the larynx. In particular, nearly every intrinsic laryngeal muscle, the exception here is the cricothyroid, is going to be efferently innervated by the recurrent laryngeal nerve. And the recurrent laryngeal nerve is going to be the afferents from the mucosa distal to the vocal folds within the larynx, and they will be secretomotor to that same mucosa. So recurrent laryngeal nerve is afferently and secretomotorily serving the laryngeal mucosa inferior or distal to the vocal folds. And then last but not least, the recurrent laryngeal nerve also is going to efferently serve the cricopharyngeal part of the inferior pharyngeal constrictor muscle. So not only is the cricopharyngeal part served by the pharyngeal plexus, but it's also served by the external branch of superior laryngeal as well as the recurrent laryngeal nerves. So that's quite a bit. So let's take a look at this pharyngeal plexus that I've been mentioning here and there. It's really a combination of several nervous structures. So there's going to be vagus, glossopharyngeal, and then sympathetics from the superior cervical ganglion. But let's start with the efferent components of the pharyngeal neural plexus. Number one with a bullet, vagus. So 10 is nearly everything efferent within the neural plexus. The exception to this is that 9 is efferently going to serve stylopharyngeus. We should note, as previously discussed, that cricopharyngeal part of the inferior pharyngeal constrictor, so this is the portions of this muscle which attach to the cricoid cartilage, those are going to be served by the recurrent laryngeal nerve, the external branch of superior laryngeal nerve, as well as the plexus. So vagus has a lot to do there. Now the afferents. Afferents are largely glossopharyngeal nerve. It's important to note that the pharyngeal plexus is also going to serve much of the soft palate as well. The exception among all of these soft palate muscles is that the tensor veli palatini muscle, we'll hear about that in a subsequent session, is not served by the pharyngeal plexus, not efferently innervated by vagus, but rather by a branch of V3, which is the mandibular division of the trigeminal nerve. Another important thing to note is that the nasopharynx gets its own sensory innervation, and that's by the pharyngeal nerve of V2, which is the maxillary nerve or the maxillary division of trigeminal. But other than those regions, glossopharyngeal nerve 9 is going to be the afferent. In terms of sympathetics to this plexus, sympathetics are all coming from this superior cervical ganglion. They may not arise at the levels that are formed, that this ganglion is formed from. They may actually, ascend the cervical sympathetic trunk on the way to this ganglion, but this ganglion is definitely the clearinghouse for the sympathetic fibers for the plexus. The last thing that I'd like to discuss here as part of the pharyngeal plexus is its role in modulating the pharyngeal reflex, or the gag reflex. So a reflex is something which is done automatically in response to a stimulus. And in this case, the stimulus might be foodstuffs or some object touching, the root of the tongue or the soft palate, or especially the walls of the pharynx. And what that is going to do is that stimulus is carried by 9, which is the afferent. 9 carries that back to the brainstem, and the brainstem sends out a response through vagus, which is the efferent to the pharynx. And that response, which is elucidated, is for the muscles of the walls of the pharynx to contract strongly and bilaterally. What this is going to do is, if it is an unexpected item that's stimulating the pharynx, it's going to prevent the pharynx from remaining patent enough for that thing to travel down or distally through the pharynx, so as to not end up with a choking situation. And so that response, that people give is really adaptive in helping to prevent choking. Now, the literature has some interesting things to say about this response, but generally, if you're going to be a dental healthcare professional, it's probably important that you're aware of the pharyngeal reflex, this gag reflex, and that you may be working in this area. And so if you touch the wrong thing, the interesting thing to note is that about 1/3 of people have no gag reflex. Another third of people have what's known as the gag reflex that we would consider. And then another 1/3 of people have what's known as the hypergag reflex. This hypergag reflex is going to elucidate a response from more than the pharyngeal muscles. In fact, it may end up with an emetic event, meaning someone could throw up as the result of a stimulus elucidating the gag reflex. So do be careful what you're touching when you're working in the oral cavity, especially when if you venture into the oropharynx and beyond. So let's look at this particular question to assess what we've come away from this particular video with, among other things, I hope. So there are 3 sources of motor innervation to the cricopharyngeal part of the inferior pharyngeal constrictor. All of these are branches of which cranial nerve? Is it A, 11, B, 7, C, 9, D, V2, or E, 10? Well, considering we're talking about motor innervation to a pharyngeal muscle, I hope that E, the vagus nerve, 10, popped into your head. So what are these 3 sources of motor innervation to the cricopharyngeal part of IPC? Well, let's think about it. So we've got the pharyngeal plexus. We also have the external branch of the superior laryngeal nerve. And we also have the recurrent laryngeal nerve. All 3 of which are branches or are efferently served by the vagus nerve. Thank you very much for your time.